Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub podcast, The Future of Mental Health. Hi, everybody. Welcome back to another episode of The Future of Mental Health. Today, you're going to hear from a true mover and shaker, Kim Keck. She is newly appointed CEO of Blue Cross Blue Shield Association, which oversees the Blue Cross and Blue Shields across the country, which collectively provide healthcare coverage to more than 109 million people across the U.S. She's the first woman to ever run this organization in its 40 years. How cool is that? In this episode, she's going to uncover major disparities of health and things that she is working on at Blue Cross Blue Shield to help those in vulnerable populations. Did you know that 60% of health is determined by your zip code, not your genetics? Things like economic stability, education, housing, levels of violence, environmental conditions, these social determinants factor into your overall health. People living just a few blocks apart have vastly different opportunities, and it's no different for mental health. There's a long way to go to change mental health care in this country, but I am so confident with leaders like Kim, we will shape the future of mental health. I think you're going to learn a lot, and I really hope that you enjoy this episode. Going into Blue Cross Blue Shield Association that's been around for 40 years, can you tell our listeners like a little bit of an overview of what that is, that organization, and maybe what you will be doing in your role?
Sure. So thank you. And first of all, thank you both, Marjorie and Patrick, for having me with you this morning. Your work is fantastic. And if I can help in any way, shape, or form in amplifying your great cause, happy to be with you this morning. First and foremost, the association, Blue Cross Blue Shield Association, is a policy influencer, if you will, for healthcare policy at the national level. So Blue Cross plans across the country insure 1 in 3 Americans. So the influence there is pretty significant. The second thing is the Blue Cross Blue Shield Association is the insurer for about 5.5 million federal employees. Thirdly, there's a governance role of sorts that the Blue Cross Blue Shield Association plays for all of the 36 different independent Blue plans across the country. And lastly, and importantly, I see this role as an opportunity to take the great work that Blue Cross plans do in their local markets, right? So today I sit Blue Cross Blue Shield of Rhode Island, and we do some great things in Rhode Island. And I can't wait to take it to the association to amplify and build a stronger system by doing just that, amplifying the great work of the 36 plans in their local markets.
Well, Kim, we're just so grateful for what you've been able to accomplish in Rhode Island. Having represented Rhode Island for nearly 2 decades, I can say that all of my former colleagues in government have really enjoyed working with you to try to put together a much healthier state insofar as finally mapping out a roadmap for a healthier Rhode Island. We love the Rhode Island Life Index. And, you know, I remember growing up in college and young adulthood and seeing how Rhode Island was so organized with respect to the kids count and really trying to wrap their arms around how do we do a better job at improving communities. So tell us a little bit about that initiative and how it helps instruct, people like yourself who are in the power places that you're in to make decisions. So if you have this Rhode Island Life Index at your disposal to help you make those decisions.
Sure, happy to. So, and thank you for the kind words. I'm sure they're generous. But what I would say about the Rhode Island Life Index is we set off on this journey at Blue Cross with partners at Brown University School of Public Health a couple of years ago to get at this overarching issue of health as opposed to health care. So we know the vast amount of literature says that, pick a number, it's a substantial number, 60+% of someone's health is determined by their zip code and not by their genetic code. So where you live. Do you live in a safe community? Do you have affordable, secure housing? Do you have access to food, transportation? Do you have job training where you live? So these issues, often called social determinants of health, impact a vast majority of someone's health and impact their health care, right? So I am a health insurer and I pay for health care. But we all in Rhode Island are looking at how do we get at the fundamental issue of health and well-being. And so the Rhode Island Life Index that we started 2 years ago has identified, by speaking with Rhode Islanders, what are the barriers essentially to you achieving your optimal overall health and well-being. And what we found in 2019, I guess it was last year, the number one issue that Rhode Islanders were in need of better outcomes or better issues to handle is safe, affordable, secure housing. That was true in 2019, and that's true in 2020. It's not terribly surprising. We know this, but what we've done with this Rhode Island Life Index, to your point, Patrick, of using this data for something or using Blue Cross's position for something, we have convened in fact, we call it the Rhode Island Life Index Coalition, I believe, a bunch of community and business leaders to say, okay, how do we all lean in and coordinate and collaborate to solve these material issues, right? How do we invest in things like housing, which Blue Cross has used this data to say, we're going to use not just our convening authority, but we are going to use our own philanthropic dollars to invest in safe, affordable, secure housing. And working with experts that do this, by the way, because we are not experts in housing. We are using this data to shape policy in the state of Rhode Island. It's an opportunity to convene and lead and importantly, take some action. And we're excited about it.
So, Kim, I think this is so significant, especially going into your new role as president of the Blue Cross Association. And that is, how do we align incentives? Too much of healthcare, too much of government is fixated on very narrow horizons when it comes to achieving an ROI. That undermines our ability to really do what we know works in the long term.
Yeah.
Your leadership, bringing that to the national, will be so key, because I think that, there really, I think, is an alignment between government and the private sector, provided we can take the ideological piece of it out and just stick to the facts and what works. I think the opportunity on the financing side is that we have to, out of necessity, look for new ways to better spread the dollars and get a bigger impact for them. So talk a little bit about how we can embrace sort of novel, innovative, or frankly, old school notions of aligning incentives through better financing mechanisms and how to bring them forward.
Yeah, it's a great question. We could spend all of our time on that topic. So I want to say a few things. Futuristically, looking to the association role, one of the things that I would say is one of the major platform pieces from a policy perspective, and not just policy, but action, but starting with policy, will be on this issue of health equity, right? We know under the last, whatever it's been, 10 months now or so more on COVID, right? This incredible impact that this virus has had disproportionately on people of color, people that are more vulnerable to all of the things that we were just talking about in terms of having a safe place to live, right? So one of the major platforms at the association will be health equity. That will span a whole number of things, Patrick. So certainly it'll get at data. Let's actually start to collect data in a way that we can actually shine a light on some of these, I'll call them lack of equity or disparities to begin with. Two is, how do we create a platform or policy to collect actions to say we are going to now more holistically start to think about investing in some of these social determinants, these life factors, things that get in the way of someone's health and well-being, and yet impact healthcare. I know in healthcare, like anything, you get what you incent. And in healthcare in Rhode Island, we have for a long, long time likely incented the wrong things as it relates to mental health. And we have for the last several years tried to morph and change that. In the state of Rhode Island, about a quarter, this is pre-COVID, about a quarter of the adults in the state of Rhode Island have sought in some way, shape, or form mental health services prior to COVID. That number has significantly increased in COVID. The vast majority of those adults seeking care got two things: beds and meds. So inpatient beds, right? Going to a hospital and being in a hospital bed, or meds, medication. And partly that's because that's what our system incented. And those may be needed, but I don't think that they're the only things. And there's a whole host of shortcomings by only having a system that's focused on beds and meds. So we've done a lot to mitigate that, or align differently those incentives to create better outcomes. I think there's a national opportunity to have a dialogue about the policy and the health equity pieces.
So there are going to be calls to action to change public policy. But given this watershed moment, there is a much bigger social call to action so that we can actually take this unprecedented moment and make an unprecedented change in the way we look at whole health. And, in the advocacy world, it's people. It's the safe place, like you talked about with housing, and its purpose. What kinds of things do you think we could do to help expedite integration of mental health into overall medical care?
I think there's a lot of things we can do. I think I would try to build upon some of the things that we've done in Rhode Island, which some are pretty conventional and some are not. So one of the things, for example, is we've removed things like prior authorization for in-network mental health and substance use disorder services. So, oftentimes in insurance, if you will, there are gates to determine how patients can proceed through the delivery system. And those gates are designed primarily for cost and quality. We decided in mental health, there's so many challenges in getting access to care to begin with. Let's just remove the gate. 2 or so years ago, maybe 3 now, we partnered with Rhode Island PBS to put together programmatic efforts to educate Rhode Islanders on a specific portion of mental health, which was substance use disorder. Even things like how we speak about substance use disorder. We disseminated thousands of little cards that say, look, we don't call someone who has cancer someone who's using. We don't call them dirty. We don't call them clean. We don't call them sort of addicted. So let's just change our language so we can reduce stigma to help people get services. So think about all these things as taking away barriers. We've invested in quality programs to get this integration that you speak of, Patrick, including electronic medical records where hospitals and physicians can connect with one another. We've invested even in some of the ways we've created bundles of care. So if you have an integrated care program where you can go from the physician to the hospital and outpatient services, so you can see like group therapy or something like that, you have one responsibility as your from your copay, if you will. So you don't have to actually pay every time, which may reduce your likelihood to stick with these programs. And then importantly, particularly since COVID, but we started this pre-COVID, last year about this time, we offered mental health through our telephonic or video services, which we have substantial use of in 2020 since COVID. Actually, our mental health online services have, I don't know, there's something like 75% of all of mental health used now in Rhode Island is physician anyway, or clinician is through online or video. So there's a number of things we can build upon. Those would be some examples. There are far more, but there's a long way to go. We're committed to do it, and it's too critical not to. I agree with you.
Yeah, and the work that you're doing with kids and helping to fortify them so that they're better prepared to address the potential onset of mental illness and addiction by having that social emotional learning skill set, having the problem solving, coping mechanism development. So crucial. Could you talk a little bit about the significance of that, especially since these are illnesses that obviously have an enormous debilitating impact on people throughout the course of their lives, as opposed to much of the rest of disability in medicine, which predominantly affects people who are at the end stage of life.
Yeah, sure. So the program that I talked about with the Rhode Island PBS Public Broadcasting System we created was first and foremost for community leaders. We brought forth a program on the challenges of substance use disorder, how to detect it, how it shows up, what resources are available, how to, again, speak about the illness, or the disorder, how to really identify some of the early warning systems. And we made it into component pieces that could be shared in high schools so that vulnerable populations could at least begin to understand some of these ways in which they could talk about this issue, potentially be aware of it, seek services from it, and understand where to go. Even on top of that, in elementary schools, we have done an awful lot of things working with different organization on an organization called Playworks, where we come in and partner with Playworks. I think we've brought it to over 80 schools, elementary schools in the state of Rhode Island, where we actually create a safe, constructive environment in recess. We physically build playgrounds and the like to have but the resources are really geared toward how to help with conflict resolution, how to include all people, so how to create an inclusive environment, how to deal with some of the vulnerable population where they're so easily influenced at these ages, so that they can have not just a productive and collaborative resource, but they go back to the classroom and they're actually better equipped to learn. And teachers and the research says this is exactly what happens. So there's an awful lot we're doing that touches so much of the population in Rhode Island on these important issues.
I love that. I think that's just incredible that you just assume that if someone's doing better on the playground, they're not bringing that into the classroom. And that makes a lot of sense. And I know Patrick's going to keep drilling down on more and more questions, and I'm going to deviate just a little bit because I think all of this is so important, but I would love to talk to you about the role that you've played as a woman and as a leader, as an advocate for women's leadership and a true role model who has climbed the ranks in a real male-dominated business. Can you speak to a little bit about your unique perspective and what importance the role is about moving the needle on gender diversity, especially in healthcare?
Sure. Thanks for the question, Marjorie. I think I too don't talk a lot about this issue, and I'd say a few things. I was really, really fortunate pretty early in my career to have a sponsor, and I didn't necessarily even seek out a sponsor. I didn't know I wanted one. I didn't know I needed one, but very, very early in my career, I had someone that really pushed me to do many, many different things. He gave me challenging assignments, even when I didn't think I could do them. I didn't have the confidence to do them. I wanted to actually back out of them. And this mentor, this sponsor really encouraged me to, not even encourage me, push me to be successful in new assignment after new assignment after new assignment. And he told me at the time that he did this on purpose, that he had a plan to take people of color or women and put them in challenging roles to help them excel in their careers, give them a path that they might not have normally had or ordinarily had. And it was really incredible. So I certainly have tried to emulate some of that in my own being a leader in my own career, helping people that work for me, helping them sit in different seats, because this is what this particular sponsor did for me. He had me sit in jobs that I don't think anybody else wanted and were really, really hard jobs, but they were rewarding in so many incredible ways. So I've tried to emulate a little bit of that.
I'm curious about, you've done incredible things in your career, both at Aetna before you went to Blue Cross Blue Shield of Rhode Island. You've taken this really deep, very thoughtful, very empathic lens of healthcare, total healthcare, at Blue Cross Blue Shield Rhode Island, and you learned a lot. Partly it comes up because Patrick just loves Rhode Island. So he talks about Rhode Island a lot. So I hear about Rhode Island from him, but it comes up a lot as an incredibly innovative state. And now you get to go into this much larger role. What are you optimistic about?
Well, I, like Patrick, have a special place in my heart for Rhode Island. Spent the first 18 years of my life here, and the last almost 5 as well. Just took that 28-year hiatus in the middle. But in any case, I'm really hopeful that we can build on the local strengths of all of the Blue plans. One of the things I said that the Blue Cross Blue Shield Association role is amplifying this great local work to strengthen how 36 Blue plans create a stronger Blue Cross Blue Shield system. And Rhode Island has been a leader in so many ways. Certainly, I'd like to think we've made some dent in the mental health needs of our residents of our state. It's more to go, but I think we've done that. The community investments, the things that actually impact our health, like where we live and food security and the like. So I want to take something like that to the association. I also want to take another effort that's underway in the state is exactly on some of the things we've been talking about this morning, which is how to invest, again, programmatically, philanthropically, convening, leading on the health equity issues. So I think the platform for the association is fantastic. I think the 36 different Blue plans across the country are doing great things too, and I hope to build and amplify on all of that at a national level.
I do think this is a moment where we have to face this part of our history that segregates us based upon color and creates a kind of tolerance for the intolerable where we treat each other differently. And that has to change if we'll have any hope for the future of coming together as a nation, given the huge polarization politically. But I think it all comes back down to that sense of community. Rhode Island has this sense that we're all part of it because we are so small. We all know each other. And I often joke with folks that you can tell who's coming down the opposite side of the road because you can tell from their license plate who it is. That kind of small town nature of Rhode Island, I think, is kind of at the heart of what we need for our country. And that is we have to start really local, like you keep pointing out. I'd like to think we could have these huge plans, and I think we need to have both the grass tops and the grassroots, but I really appreciate your understanding about that local approach, that zip code versus genetic code approach, because I don't think that's part of our literacy as public policy makers, and your role in Blue Cross Association is going to be very key to helping us disseminate that. And as I said, this is the most historic time, I think, for our cause to change just our sense of community, I think, is really what it's all about. Because if we're in it together, if we think about each other as connected, then we're not going to allow a lot of these huge gaps in the way people are not afforded the same opportunities in this country as others. We're not going to permit that any longer, but we have to see each other as sisters and brothers in a real sense for us to achieve that. So can you talk a little bit about the kind of spiritual dimension of community, in Rhode Island? I think it's very much part of our fabric.
I agree with you. And I might even bring it down a level to the state, which I 100% agree with everything you said. It's, we have to start seeing our connectedness. There's no doubt in my mind. And as I think about that at a more granular level than maybe zip code, I think about it at the company level. I run a company, an insurer in the state of Rhode Island, Blue Cross Blue Shield of Rhode Island. When I first came to this role, I decided I want to focus first and foremost on our culture and how we lead, not just what we do, but how we do it. And to your notion, Patrick, of being connected, this is going to sound like a huge stretch in an analogy, but I mean this. One of the things I had put in place fairly early on is what I call values in action. They're not just values. We all believe that we act with integrity and collaboration and respect and the like, but I want to make values in action really accessible, that people understand, oh, do I do that or not? Right. So assume positive intent, for example, or share what you know and make it accessible to others as two values in action. And I use these because, to me, a third one I started with is have the courage to put the issues on the table together. Again, this is just in running a company, but I share them as sort of my personal values of saying we've got to be connected. We can't look at these things in silos, right? When I said to my associates, have the courage to put issues on the table together, it's because we had silos, we had divisions. I'm like, no. We are one company. We're going to lean in together, make what you know accessible, share it with others, right? We're not going to hoard information. I know these things sound silly. This is a microcosm of a company, but look, if we did this holistically as a state and as a country, I think we'd alleviate a lot of issues. And so if we can take down silos and we can lean in together and use these values in action, just even assume positive intent. A great sponsor of mine 20 years ago said, we're going to assume positive intent in everything we do. And it's amazing how little steps like that can just, take away barriers and find ways to connect us and lead and understand what we have in common as opposed to the opposite. So I'm hopeful. This is a time that is, I agree with you, an incredible opportunity for change. And I feel we're at the precipice and maybe out of necessity, but that's okay, for significant positive change.
You're getting the opportunity to lead with that change, which is really great. On the subject that we're so passionate, which is mental health and substance use and suicide prevention, which are all underlaid and threaded into all pieces of healthcare. If you had a magic wand of how you could see this kind of playing out across the whole Blue family, now you're taking this to this national field, and you've got a huge opportunity, Kim, huge opportunity you have. I mean, just not to put any pressure on you, but just going off of your number that 1 in 3 Americans are on one of these plans, that is tremendous opportunity for impact. So if you had the magic wand with the mental health lens of it, knowing what we know, that when people have good mental health, everybody benefits. Just like your analogy in the classroom, just like the analogy in the healthcare setting, we're less likely to show up in the ED. We're less likely to show up at our healthcare appointments, and we're overall functioning better, and everybody does better with better mental health care. What does your magic wand future look like?
I would say I feel reasonably optimistic, more than reasonably. I feel optimistic on the opportunity to even sort of, I'll use the words, bringing together 36 independent plans to collaborate and convene. I actually feel good about that. But I would probably first use my magic wand on, I think, the delivery system. Because again, I feel reasonably good about the public health work, but I think we're at a time that a lot of really smart and influential people are leaning in. But I really think we need some help creating a continuum of care holistically in the mental health, right? So from prevention to inpatient beds in a way that is easy to navigate and seamlessly and doesn't sort of lose people along the way. We even have some great programs in the state of Rhode Island, and I'm proud of them. One of the challenges we have is they don't get used, or people fall through the cracks, or someone starts in a program but doesn't finish a program. Now, people need to be prepared to start and finish on their own, right? We often call some of substance use disorder, we sometimes call it disease of readiness. And so there's a whole host of reasons why we don't necessarily have the success rate in some of our programs, but they're fragmented and they need to be integrated from sort of prevention to hospital beds and everything in between in a way that is seamless and easy to navigate. And I had one magic wand, I'd probably use it on that, creating that. And even not just in Rhode Island. This is a national issue. This is not something that exists as well as it needs to in the United States. So I'd start there.
And Kim, look forward to working with you on that and harnessing the recovery community to help. They are vested in this notion, that's a very spiritual one, that their own recovery depends on helping others achieve recovery. And our whole criminal justice system is looking for a way out of having to spend all of their time on mental health and addiction issues, given the fact that over half of the justice-involved system has a mental health addiction issue. We're going to see major criminal justice reform, hopefully, address systemic bias, do all of those things. And mental health is going to be in the middle of all of it. It's going to be in the middle of, education. It's going to be in the middle of, even for our state, which is such a elderly state, so crucial to geriatric well-being, given the fact that we as a society and culture really relegate our seniors to the sidelines. It's really unfortunate. In again, part of our culture that doesn't think of itself as we're all in it together. So I think a lot to do, exciting times. I think with the new president who's focused on a lot of the innovations that you spoke about in the insurance world, the kind of bundle payment, value-based contracts. Let's look at outcomes. Let's see how we reward, better care. I think that's all going to be good for mental health. And I appreciate your taking the time with us today. I know you're extremely busy, but we really are grateful for your having been with us.
It's been my pleasure.
Thank you, Kim, for being such an awesome person and for continuing to fight this fight and be on this journey. I think not just the 1/3 of American lives that you're going to touch are grateful, but we all are, because listen, when people and organizations and entities start to see what works, they're quick to follow. It's harder to lead and break glass. So we're grateful that you're at the helm and doing this. And thank you so much for taking your time with us today.
Thank you. Thank you for your great work. Proud to be spending a little bit of my day with you, and keep up the great work and look forward to continuing the conversation.
What's cracking, Hope Nation? It's your friendly neighborhood, Kevin Hines, and here's the Psych Hub Brain Health Tip of the Week. Sleep is the most important part of your day. We spend 1/3 of our lives in bed. There's more to sleep than just shutting down the brain. Without a good night's rest, we don't retain information as well. It impacts our mood, our motivation. With small changes, you can work your way to a healthier sleeping habit. Start your day the night before. Make a list of everything you need to do tomorrow before you go to sleep. That way you don't think about them throughout the night. Avoid light distractions and turn off the TV before bed and disconnect your devices. Stop drinking caffeine later in the day and don't eat too late. And if you can't sleep, get out of bed. You don't want a connection between your bed and the frustration to be able to sleep. Get up and do something for 20 minutes to get your mind off of sleep before returning to bed. If all else fails and you persistently have trouble sleeping, talk to your mental health provider about insomnia. This can really help you find a way to a better sleep pattern, a better circadian rhythm.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.